Hello everyone, I'm David Fairhurst, Executive Chair here at Mutual Ventures, and I'm here to welcome you to this session, which will be focused on Staying Close, a programme of support for young people before and after they leave residential care. Hopefully you're all very well aware of that. We've put this together at pretty short notice to fit in with timescales for those of you submitting expressions of interest to DFE, which is towards the end of April. We do intend to run a more comprehensive session on Staying Close on the 19th of May that'll explore the learnings from the Staying Close pilots in more depth and also involve speakers from the pilots to a much greater extent. However, we thought it would be a good idea and hopefully beneficial to those submitting expressions of interest at this point to at least have the opportunity to hear from some of those that have been involved in the Staying Close pilots to date. The session is therefore going to be quite informal as we've put it together just over the last sort of couple of days. And it's an opportunity for you to ask questions of us and representatives from some of the pilots who are joining us today. Mutual Ventures, together with Innovation Unit, have been providing coaching and technical support to the Staying Close pilots over the last 4 to 5 years, firstly through the innovation programme, then latterly directly via the DFE policy team. And our lead coach in this area is Francis Flaxington, and I'll hand over to Francis very shortly to lead us through the session. If you do have questions, please post them in Zoom's Q&A function, which you'll all have access to, and we'll get through as many of the questions as we can today. If we don't need the full hour, then we'll wrap things up. But if the questions keep coming, then we'll take them right through until 5 o'clock, and we'll finish promptly at 5 o'clock. So I shall pass over to Francis without further ado, and Francis will take us through the rest of the session.
Thank you, and thanks to everyone who's joined us this afternoon. I can see the numbers are climbing as we speak, and what's really exciting is that having piloted Staying Close, 8 pilots across the country over the last few years, we're now at a point where they are going to be, that Staying Close is going to be scaled, and we're going to have new providers. So it's good to see that so many people have joined us. And how we want to run the session this afternoon, as David says, to keep it very informal, but we thought we'd do some very quick inputs and working very much as the team that we've had in place between the pilots, the DFE and the coaches over this period in explaining Staying Close, what it is, what we've learned, and then opening up, as most of this is really about you asking your questions. So the team we have this afternoon is Katie, our policy advisor from the DFE, whose passion and commitment for Staying Close will very soon clearly be evident. And then we have several of the pilot now programme leads, including Julia from Suffolk that I can see today. Hope we've got some of the others on our call, and they will join us too. In fact, leads, if you are joining via the ordinary Zoom, please join as a participant so that we can see you and bring you in to speak. So just that's a message out to you as well. And in terms of what we're sharing from today, just to say that it's very much based on the learning working across the 8 pilots and what we've learned over these few years, and 6 regional events that we held between September and November last year, where we shared the learning and discussed with people who are potentially would be interested in Staying Close moving forward. So we're sharing some of the insights from those learning events. And 2 highlights I would say is that Staying Close builds very much on informal practice that was in place before the pilot started. There's a lot of good practice out there, people wanting to keep in touch with young people in transition, but that Staying Close has been a lifeline. And if that's one message that you take away from this afternoon in terms of why we think it's so important, that would be great. So firstly, I'm going to hand over to Katie, who's just going to talk to us about the context and the ambition for Staying Close. Then we'll move on to explaining the framework and what we mean in terms of the core elements of Staying Close. And then we'll move swiftly on to Q&As. And as David said, post your questions in the chat and we will come on to them. So Katie, over to you.
Thank you very much, Francis. Hello, everybody. I'm Katie Adam from the DFE and the policy lead on Staying Close. I'm just going to kind of whiz through these really, because if you attended the learning events, it's something that we talked about anyway, and a lot of this information is already in the guidance that was sent out with the expression of interest. So a bit of context, bit of background. So Staying Close came from a recommendation from Sir Martin Nary's review of residential care in 2016. And from then, the DfE made a public commitment to roll out staying close nationally, but said that we would pilot it first to inform kind of learning and that future rollout. At the basis of it is designed to offer secure and stable accommodation, practical and emotional support, similar to and be comparable to staying put for young people leaving foster care. So since 2017, we've been funding 8 pilots, a mixture of local authorities and private providers. And all the pilots have operated slightly differently to take into account their local context and to meet the needs of their specific cohort and young people. Very much a bottom-up model, which is why we're giving you that flexibility and freedom to build and develop your own models. But at the core of every model, every package is that offer of move-on accommodation from the children's home and a package of emotional and practical support from a professional who they know and trust. Next slide, please. So why is it important? Well, I guess that everybody has heard a young person describe leaving care as a cliff edge. That support falls away and they're faced with responsibilities of adult life, which we know can be very overwhelming. There's things in place, but despite these improvements in leaving care support, too many care leavers continue to face that cliff edge. So new measure that is being put in place offers around half young people in foster care now stay put, so and stay with their former foster carers. We have extended personal advisor support over to the age of 25, but we know that the transition is still difficult for a number of reasons, and Staying Close tries to address this. I'm not going to talk through all of these, but the slides on here, but we know the impact that leaving care can have. And as I said, we hope that Staying Close and other measures provide that support and to improve these areas. Next slide, please. So what do we want? We talked through kind of a lot about what we wanted from Staying Close, and over the years we've kind of come to an agreement of what our ambition is, and we want to achieve a wider geographical spread for Staying Close. So currently it's piloted in 8 areas, so we want to really see a spread in different areas, so we can really understand over the next 3 years what that means for different localities. We also want it to be offered to as many young people as possible, so really building on the learning that the pilots have found and how they develop their relationships and build those relationships with their young people, and to see it as a recognised and sustainable model of good practice, and those policies and practices really embedded, that cultural change really embedded within the authority. Luckily we managed to secure the funding, which is great. So our intention is for successful bidders to deliver Staying Close, with new bidders coming on board over the next 3 years. And ultimately, the main ambition is to reach a point where we can legislate, put a duty on local authorities to offer Staying Close and mirror the current duty of staying put as we know it now. It is a tight turnaround, as most DfE bidding rounds are, so I can only apologise for that, but we are where we are. But I hope you get learn more about Staying Close, and that you're in a position to offer Staying Close to young people who you support. And this gives you the opportunity to ask any questions that you have whilst you're working through your bid. So thank you.
Thanks, Katie. And David, the next slide. So we wanted to explain the Staying Close framework and how we arrived at this framework, because what has been interesting over the 4 years, because the money for the pilots was extended during the pandemic, was that the pilots were given freedom to innovate. And they all took different approaches supporting young people through transition. But when they came together to look at what was common and core and what's become central to Staying Close, the same elements kept coming up again and again. If we have the next slide, David. So what we wanted to just share with you today is our Staying Close framework, or a butterfly, if you will, as some people have said. What I want people to focus on really is the core: accommodation and ongoing support. What is key and critical to the Staying Close approach is young people having options about where they move after their children's home. And obviously this is key to preventing the cliff edge, preventing homelessness. And alongside that, the twin to that is ongoing support in a trusting relationship. And we often get asked, but who provides that support? And although the original model was for that to be someone from the children's home, in fact, as the leads will tell you, that has varied, with an emphasis very much on young people having a choice, so that it's not always someone from the children's home continuing to support them into their transition into independence. So if you see that as the core that we would expect people to adopt, then the other circles really are about the other wraparound support that young people need, and wanting you to think about what will work in your area, in your geographical area, and for your cohort of young people. So all of the pilots found it important to think about provision of access to some sort of clinical services, whether it was a psychologist directly employed part-time, accessing resources elsewhere in an organisation. Because as you can imagine, young people's health and well-being in particular was exacerbated by the pandemic. But you will know there were so many issues that these young people face in terms of substance misuse and other problems. And equally, in terms of the practical and emotional support that they need in terms of developing life skills, so that they then find a route into training, education, or employment. It's that holistic support that Staying Close can provide. And if we just go on to the next slide, because what we would emphasize, nope, I'm missing a slide there, I think. Missing a slide, there we go, there we go. I think what you will hear that is really important, and knowing some of the people that I've seen down for the call this afternoon, you will know the importance of relationships. You will know the importance of listening to young people and of tailoring the support to meet their expressed needs. You will not be surprised to hear about love, support and care for these young people as the safety net of the children's home goes, and we support them into independence. So if you take from this part of the presentation in terms of please adopt that core, the place they can call home and someone they can trust, but then think what else they need to thrive in the future. And if I just move on, I'm going to ask Katie just to talk about the impact that we've seen for Staying Close.
Thank you, Frances. So we did independent evaluations of the Staying Close pilots, which were published in November 2020, which seems a long time ago now. The pilots themselves have also undertaken independent evaluations, and we looked at cost-benefit analysis also. And what we've found is that young people leaving care, it's a clear transition to having improved housing options, and we're seeing a huge increase in reduced eviction rates. We also see that the proportion of young people recorded as being in education, employment and training has increased overall. Obviously, as Frances said, this has been impacted by COVID. But the pilots really did put in a lot of time and effort to look at how they could work with their young people through this time, but also moving forward from, since we've come out of lockdown, whether that be through traineeships, pre-apprenticeships, or working with local communities and organisations to build into that EAT improvement. Another thing that's come out of it is young people's independent living skills have improved, and this is in various ways, whether this be as a key worker, a skilled worker, a life skills worker. They all come under different kind of headings, but it's about allowing the young person to learn those key skills that you need when you get your own place. That's cooking skills, that's managing budgets, and just having somewhere to go and ask the questions, we've found has been really important to really embed that confidence in a young person. Next slide, please. Again, I probably won't talk through the slides as such, as because you can see the impact on here within the numbers from the independent evaluation reports that have been published. But again, it just reflects and really hits home kind of the areas that I was talking about. So, you know, that improvement in housing and having that secure and stable home. Reduction in homelessness has been, you know, that there's some real links within some of the pilots. I know Julia on the call with Suffolk and North Tyneside have really linked into their their rough sleeping agenda, which has been great to see. And again, that innovative thinking around education, employment and training has really seen some improvements around EAT. And health and well-being, you know, that we can see that Break there have seen those relationship management skills, you know, healthy relationships as well, and learning how to move away from those unhealthy relationships and those bad habits that can be formed. And yeah, as I said, seeing health and well-being improved, whether that be mental health, physical health, that real kind of clarity on what the steps that need to be taken to lead a more secure and stable independent transition. So thank you.
Thank you. So what I'm going to do is ask the leads, I'm not going to go through all of these, but just ask them to comment on a couple of our points of advice to you. And please, can I also suggest that you start posting your questions in the Q&A, because we're going to swiftly move into that opportunity for you to pose your questions. But you won't be surprised that we're going to start by asking Julia from Suffolk to just talk about housing options and why that's been such an important element of staying close.
Thank you, Frances, and hello, everybody. Housing options, as probably everybody here will understand, there's the access to housing is becoming more and more a challenge as we move forward. What we've done in Suffolk is to ensure that we've tried to utilise all of the housing market, so not just reliant on social housing, so making use of the private sector, being able to work with our partner agencies, both with housing associations and our district and boroughs, to make sure that we can get access to all of that's available. What we've done is we've been able to repurpose and already commissioned supported housing units, and we have very much a pathway approach, which is residential into semi-independent, then into independent, but also it's a step up, step down model, which is very much an area where young people can expand and learn as they go without the worry of losing their accommodation. So as I say, that's very much why the solutions we've looked at using every possible thing we can, focusing very much on, it's not one size fits all, very much focused on the needs of that young person at the center of it, which means obviously from a operational point of view, you then have to have very different models. So hopefully that covers that.
Thank you. Stephen, could I ask you from Break just to talk about the young people having a say? You've had a really big emphasis on co-production, have you not, in Break?
Yeah, we have. And hello, everyone. Absolutely. It's kind of the first principle of the work that we do is that as an organisation, and we're a third sector organisation, so we work across care, and young people leaving care, and young people's voice and co-production is kind of at the heart of our organisational philosophy. So that's no different within Staying Close. And I think initially kind of the commitment to doing that genuinely and really committing to being led by and co-producing with the young people is the starting point. And it leads to a service which is responsive to need, which young people are bought into. They feel in control of their own decisions. And through our independent evaluation, it really came through that young people valued the opportunity to have a say in what the service looked like, and they felt like they could have an influence on everything from what those housing options look like to kind of opportunities and participations in terms of that wraparound support, all the way through to the kind of training that the staff do so that they're more responsive to their needs. And that really came through as a positive from the young people in both of our independent evaluations, actually. So we see it as central to the success of our service, and would say our learning actually from this was that retrospectively we think we didn't do it that well to begin with, and we wished we had started with that real commitment and genuine co-production in the early days of Staying Close, Staying Connected. We ended up retrofitting it kind of after a year or so. So my advice would be get it going now, and really commit. Yeah.
Really helpful. Sandra, North East Lincolnshire, just this importance of this trusting relationship. And I remember visiting you early on and you saying, well, we were doing this, but it now makes it formal. Could you just say a little bit about that?
Yeah, hi everyone. So sort of a lot of the care officers from the children's homes were doing things like dropping in and checking on young people and care leavers on the way home. And it was all sort of done out of the goodness of their heart, really. Whereas at least now this is like, it's formalised it. So when young people identify someone important in their life, if it is someone from a children's home, at least they can they don't have to rush off on the way home and, spend some valuable time to support young people. And they have done in North East Links.
Great. Thank you. And we've got a couple of questions coming in, and will people please use this opportunity to post them in the chat. But I would just like to emphasise before we move on to the questions, Stephen very honestly shared about the importance of building in co-production from the start. I would also say monitoring processes in terms of being able to demonstrate your impact. That's something we've spent quite a lot of time discussing across the projects. And also governance arrangements. DfE is sent out with the information with the EOIs, what's described as the strategic triangle, and that places an emphasis on being absolutely clear why you want to do Staying Close, what you need to be in place to do it, and the governance around it. And again, Julia, I just wondered if you just wanted to comment about governance and how that supported you to draw in partners from across the council and more widely.
Yes, thanks, Francis. Absolutely. I think the governance, we have the support of our head of corporate parenting, but our project board is wider. We have the head of virtual education, we've got somebody from housing, and I think that very early it became obvious that's what we needed to make sure that we had the board as our enablers, to make sure that we could therefore use that board to link into the rest of the systems, health and wellbeing, CCGs, and I think that it's really important that you think about that early, because if we thought about it a little bit earlier than we got to it, then it would have, it would have moved probably much smoother. So that's part of our learning.
Thank you. And David, I think we'll take the slides down and move on to the questions. And I'm going to start with Julian. And actually, this one's for Katie in terms of the use of the funding, the parameters of the bid, not for capital, but with the exception of purchasing capital projects. Is there anything else that people can suggest that funds are not used for?
That's kind of it's quite a tricky question, really. I guess it's not a capital fund. It's not there to buy buildings, rent buildings, etc., etc. I would probably say, is there anything specific you're thinking of and maybe you want to ask that question to the Staying Close email address, because it's kind of, yeah, there's not really anything that's kind of making me think, no, you definitely can't fund that. The funding's there for, you know, that practical and emotional support. A lot of the funding that the pilots have used is mainly gone on staffing. That can be the independent worker, the support worker, or kind of mental health support that's coming in, that type of support. Housing specialists. So is there anything that I'd maybe hand it over to some of the, Julia and Sandra and Stephen, maybe, is there anything that you've wanted to use the funding on and we've said no to?
Not particularly. I mean, like you said about the renting of things, but we have used the money to pay for staff and support staff, you know, and things like that, really.
Yeah.
Yes, similarly, we've used for housing related support around that, maintaining tenancies and that sort of thing. And, you know, we do have housing specialists now, advisors, to support around that and sustainability. So nothing that that's springing to mind we haven't done.
Thank you. Katie, next question's for you as well, in terms of whether the indicative cost is for a year or across the 3 years.
Oh, apologies if that wasn't clear. It's an annual figure. So
there you go. And Adrian asks, how have people resolved the staying close for our children who are placed in children's homes further afield? We know some of our most vulnerable children are more likely to live at distance. How has this been addressed in the projects? I think, Sandra, can I ask you to pick that one up?
Yeah. So we've got a couple of scenarios, really. So we had one young person, a care leaver, that had been placed probably at the age of about 13 out of area. And bearing in mind we're North East Lincolnshire, I think he was actually in Scarborough, so it was still a good couple of hours away nearly. And he wanted to come back to the area. And so what we did is we approached the agency where he was placed and asked if we could pay some of their staff to continue supporting him back with the move. So and that happened for a couple of months afterwards. They would come over once a week and support him, and then eventually built up a group of associates and friends in North East Lincolnshire again, because he'd been out for so long. I think he'd got some family here, but they weren't necessarily a good influence. So that was kind of one scenario. And then we've had other scenarios where young people have been placed. We had a young man down in Essex, and our project coordinator went down to Essex with the PA, and they organised someone in Essex that he was working with, and they gave him some support in that way. So it was just about being really, really flexible and individual needs of young people. And we are quite lucky because we're not a massive local authority, so we can sort of do that on quite an individual basis.
Yeah. Julie, did you want to comment on that question?
Yeah, I was just thinking from a Suffolk point of view, we look at it slightly, we've done it slightly differently. If we have a young person who is living in Suffolk, but is from another authority, but they want to remain living in Suffolk, so they don't want to return, so the other way around, then we will offer Suffolk Staying Close. So they will just get the same service the rest of the Suffolk children do. So if we've got a young person from Norfolk, for argument's sake, and wants to remain in Suffolk, then we offer them Staying Close. So it's maintaining the links that they've made here.
Yeah, thank you. And then the next question is asking about sustainability, which is something that all of the pilots have been thinking about as they move into now provider status. So maybe I'll start again with you, Julia, in terms of, we've explained the core elements, but then you're having to think about what else you provide, this wraparound support. Could you just say something about your approach to sustainability?
Yes, and it's it's again, it's a bit of a systems approach, and forgive me for going into system speak around it, but we did early, we did a cost benefit analysis locally to look at what the unit cost is of a case study with a young person who's receiving staying close and a young person who isn't receiving staying close, and that enabled us to break down to all the system partners the benefits, the cost benefits of this, and that allowed us to open that conversation with our colleagues, CCG's Health and Wellbeing Board, to absolutely look at bringing people on board. So what we're looking at, we have also linked with our Rough Sleeper Initiative monies so that we can widen that funding approach, and linking with our district and boroughs, and that's also around, we looked at the sustainability, particularly around our housing solutions, repurposing some commissioned properties, and we're also joint commissioning support elements, not bricks and mortar, but support elements around several of our properties that include adult social care as well. So hopefully that helps.
Thank you. Sandra, do you want to say anything about sustainability?
Yeah, I mean, some of ours, we offer a weekly drop-in, and as part of the offer, we give the young people, the care leavers, a hot meal and the choice of a food parcel. Now, we haven't started again yet charging them, so they can choose, it's a food pantry, they can choose 10 items from the food pantry, and all of the produce is through a food bank that we pay an annual subscription to. And what we do is we ask the young people to pay a £1.50 fee, and they can choose 10 items to take away with them. And that in itself helps sustain the payment of the subscription and anything else that we incur with costs. I mean, the groups are getting absolutely massive. I think the week before last, no, I'm lying because we've had Ramadan, so they've really dropped off, but we are still sending food parcels to our young people. But we've had like as many as 25 young people come, not all in one go, might I add. They are spaced out sessions, and they come and they have a game of pool and, you know, share experiences with each other. We've created a really good environment for young people. So that's helped with some of the sustainability. Sorry, Francis, I'm going off a bit on a tangent.
No, I think it's just that all of you are thinking about how to embed into your local offer for care leavers the staying close approach. And Sarah, you've just joined us from Portsmouth because you have been looking to spread the model, have you, not across Portsmouth? Just wondered if you wanted to say a couple of words about that.
Getting used to this muting and unmuting malarkey. Yes, so what we did in terms of our upscaling was we used our support model that we developed in Staying Close. We found it was really effective, and when we were sort of comparing it with some of our quite high cost local providers, we felt we were getting better results. So we're working with our housing department to get more properties, and we're actually sort of rolling out the same support model but on an outreach basis across a number of properties, because in Portsmouth we have a lot of unaccompanied minors as we're a port city, and one of the things we really struggle with is accommodation, and because they've been through quite traumatic journeys and experiences in their countries of origin, then when they get to us we find that using a trauma-informed approach, which is kind of the basis of our support model, really works and has been really helpful. So I've been able to use Staying Close as a sort of stepping stone to create more options for our care leavers. And from that point of view, it's been really invaluable.
Thanks, Sarah. So I'm going to move on to another question. Victoria's asking, thinking about demonstrating the impact the pilots were independently evaluated. Katie, is this a condition of the bid?
So this is something we're still working through. We will be wanting to collect data, so we'll be wanting to continue the current providers do quarterly reports. We'll be asking for similar information. We're working with the DFE research team and analysts to really get what is key information and data. But whether it's independent, we won't be asking you to do your own independent evaluation. It would be done via DFE through different types of data and information that we'll be collecting from you.
Thank you. And I can see a separate question coming from Jeanette asking about working between local authority and a charity. Stephen, could I ask you just to talk about sort of how you work with local authorities from Break's charity perspective?
Yeah, absolutely. So the local authorities obviously don't commission us to offer the service, but we work very closely with them. They are part of our governance structure, so they sit on our board, and we attend the various kind of leading care meetings and panels around the authorities in which we work, which is Norfolk, Cambridgeshire, and Peterborough. So we work very closely with them and receive referrals from them, so they both contribute towards what the service is, and then they therefore know what it is, which young people it would suit, which young people it wouldn't suit, and so they refer into the service. I think in terms of the kind of, I don't know if any of you are kind of making the decision as to whether to deliver in-house or look at a third sector provider to deliver the staying close model, but I think that there are, I guess as you'd expect, kind of pros and cons of each. But I think from a charity perspective, what I think one of the strengths of us delivering the model is some of the additional support and kind of added value that we can bring, especially in terms of external funders and what that can bring to the service. But listening enviously to Julia talk about how she can talk to departmental colleagues in health, adult social care, housing, etc., can be a bit more difficult for us. But if you can get that bit right, I think there is real value in a third sector provider offering this. I mean, just as a couple of more practical examples, for instance, we have a mentoring service as part of the organisation, which is funded elsewhere, but all young people accessing SCSE can access that mentoring service. We have a lifelong offer, so any young person who accesses any break service at any point in their lives can at any point in their lives get back in touch with us if they need some support. Again, any SCSE young people then immediately fall into that. So there's lots of added value, I think, that the charity can bring, but it does also come with its pitfalls and that would need to be considered.
Yeah, I mean, there are different examples of work between local authorities and voluntary sector. I mean, Julia, you've worked with an organisation to deliver your life skills offer, as I recall. Oh, there you are.
No, there's always one that's on mute. Yes, yeah, we've worked with one of our local providers to develop an independence programme specifically for the staying close, which again is just focused on that individual young person's needs. And I think that we've got and it's really good. I know all the pilots have had some really positive outcomes, and that this particular provider is really strongly wanting to work with us with the staying close programme in the future. So I think there's some real opportunities to bring our other colleagues in as well.
Lovely, that's great. Paul's asking a question about numbers. So I'm going to particularly ask Sarah and Sandra on this one. How many young people are you working with at any one time as part of the Staying Close offer, split between working in the homes and after they've left and moved on into independence? Can you give us a rough idea, Sandra?
So I think we're working with about 30, give or take 1 or 2, but it's so varied. So that could mean that we're working with someone where we're offering them weekly support, maybe go in with their identified worker for a cup of tea for a couple of hours. It could mean someone's coming to the drop-in groups and getting sessions there, or it could mean that a young person's just seeking support from our health and wellbeing practitioner. So it's very sort of broad, and each young person, it comes with individual requirements for levels of support. I mean, we've had instances where a young person's left the children's home, identified a worker, they've started off with like 3, 4, 5 hours a week of support in whatever way, whether it's an hour here or there. And then at the end of like 3 months, for example, that support's dropped to like once a week for a couple of hours. But then there's something dramatic has happened in their life several months later, and that support's gone back up again for a period of time. So it really is really varied. But it is around about 30 young people. And that's not to say that's the same 30 at any one time. It may be that we don't see a young person for a few months, and then, you know, someone else comes to the group or wants, you know, some kind of support.
Thank you. Sarah?
We've got a total of 21 at the moment. So we've got sort of 12 in our sort of specific accommodation, and others that we're supporting that we've moved on to their own flats. So that was our first cohort that we started with in 2018. They have all moved on now, every single one of them, and are living independently in their own flats. But like Sandra said, the support goes up and down. So we moved one young man, you know, very capable. He'd helped out with some interviews with our original evaluators, you know, so he was quite an involved and engaged young person. Had a moderate learning disability, but he also had health problems. He had Crohn's disease, and he got himself into a really bad way at one point, became very ill. And so staff were going in every single day. We were supporting him, taking him to hospital. He had an operation which required a week's stay in hospital. We were going around every day because he said, oh yeah, the nurses are going to come and do my dressings. And we were like, well, no one's been in to see you and that dressing hasn't been changed. So then we were having to get in touch with the doctors, and no, he was supposed to go to the GP himself every day to get the dressing. And it was just little things like that. And I think when someone has a wobble, like a major health problem or perhaps a breakup of a relationship or something, it leaves them more vulnerable, and you'll notice that some of the behaviours that you'd worked with them on and managed to diminish start coming back again, because they sort of fall back into old patterns of coping. And this was certainly the case with him. So we've had to put in, at one point we were putting in daily support again, because physically he needed that, and ongoing we're still visiting once a week again until he's sort of a little bit more stable.
So a really important message about being there when young people need it, just as you would your own kids, really. So Jason, there's a question in the chat. Would pilots talk about the risks they faced in implementing testing, staying close? I go back to you, Julia.
Thanks, Frances. I think one of the risks that we faced early doors on this was helping the the senior management to understand the needs of early intervention into housing. Anybody here will have heard me say this before, but housing takes it's a big machine, and it takes a long time to get going. And I think one of the things, the risk we were running, is trying to get senior managers, as I say, to understand that actually we really need to focus on getting this housing early. And the risk of that is that obviously you have young people who are wanting to move on through, and you don't actually have the accommodation available for them. So that was one of our primary risks.
Lovely. Anybody else from the pilots want to talk about risks that they feel they would like to share?
I was just going to mention something that we ask ourselves a lot of questions about still, is the kind of risk inherent in the age group of the kind of cohort that we're working with, in terms of well, risk and safeguarding, really, in that this is a service that promotes independence, and that's striking the balance between support and being there and keeping everyone safe versus promoting independence and problem solving yourself and those kinds of things. It's a really delicate balance, and I am not going to sit here and say that we've nailed it. We have regular conversations about it, and I know kind of transitional safeguarding is an emerging area of focus, and something that we're certainly kind of focusing in on. But that really is a lot of the conversation we have around risk and how we balance that.
Yeah, and as you're speaking, Stephen, it just triggers me the discussion that Katie and we had with all of the pilots recently on the support for the staff that are supporting these young people after they leave their home, because, you know, it's a very different matter when young people are independent and facing some of the issues that they face out there, and the support and supervision that they need. Sandra, that's something that you've looked at in particular, isn't it?
Yeah. I mean, we've developed a like a bit of a support mechanism really with the coordinator. So she'll spend some time with the children's homes manager and with the care officers, and supervise them and support them in another way. We've also provided some like additional training, help. We did a what's the word I'm looking for? A hygiene. We've asked them to do hygiene, and I mean, a lot of these staff luckily already have these skills because of the children's homes requirements, you know. So, but it was about, some of it really was, what we found is that if they wanted to unravel or discuss any concerns or anything really, it's not really relevant in their role as a children within that children's home, because obviously the young people have left the home, and you know, so at least with Sarah there, the coordinator, they've got someone that they can go back to and fro from and spend and have some supervision. We've also done some group sort of type supervisions with the PAs as well, and included them. So that's been quite useful.
Thank you. Thanks, Sandra. And I'm just going to go on then to Joanne's question. So Joanne's interested in what the different models look like, recognising that young people in residential have high level complex needs. She's saying they tend to step down to semi-independent and then supported accommodation. So is the aim to look at having a particular person who would follow this person through the different accommodation projects, the consistency and additional support? So this ongoing trusted relationship. Who would like to talk to that one? Sarah.
Yes, so can you just say the question again?
I think it's saying, is it the same person who sticks with the young person?
Yeah, absolutely. And I think that's, you know, was a strength in our model. And we're obviously blessed over the 4 years we've been doing the project that we haven't had staff turnover. So we haven't had people leave until very recently. And, you know, it's interesting. It did cause an issue when this particular member of staff left for a couple of young people, because it was like, what do I do now? So I think that you do need to be mindful of how you step the relationship down as well, because it made me think, as the project manager, I've spent so much time with the staff team building up these relationships and developing these relationships, because we have a model where they have a staying close worker and their residential worker works alongside and then kind of drops off. But what was our learning from our project was actually a lot of them didn't want to stay in touch with the worker from their children's home. They were quite happy to embrace a new relationship. And then when we've moved them on, it's that key person that they've wanted to stay in touch with. So the challenge for me now is, well, how do we sort of end those relationships effectively? So it is being really mindful about that stepping down towards the end. So all the ones we've got in flats now, we have to be really mindful that we're starting to move away from being their only source of support. So it's really important that you build up young people's networks and help them develop friendship groups they can rely on. And another strength of our model was that we actually did that with them as a group. So, for example, today I heard that one of the young people was visited by a member of staff, and she said, oh, saw so-and-so yesterday. He said he's feeling really lonely. No one's been to see him for a while. That day, she texted that young man and said, oh, I'll come round and see you at the weekend. So these are sort of friendships that they've developed as a result of all living together in the same house, and because we had quite a communal group living model of support.
Yeah. Julia, you were nodding at that. Do you want to come in?
I was sorry, Francis. I think that it's really what Sarah's saying. It is that really important. We've worked that it is the wider network, so it's just not that just the one person. And the learning is that it was expected to be the person that was going to be, they were in residential home, but it's not always been that case. We have one young person who wanted to stay in touch with their previous social worker. But we have also just put in place now something we're calling family mapping, but it's lifelong links approach, to make sure that there's a more absolutely a robust network around the young person, so that when the support tapers off, we know that they've got somebody there.
Okay. In fact, at one point, I think projects were saying we should have called it being close, not staying close. But there's this combination of a place you can call home and people around you can trust. Katie, we're running out of questions now, but I think you wanted to come back in and say something on governance.
Thank you. Yeah, it was just one of the risks, I think, that over the time of the pilots, that maybe each of the pilots have experienced at different times. And that's when maybe a structure has changed within the local authority, whether, that's senior level structure or within like the leaving care team, and those contacts across, not only within kind of children's social care, but across the department, across the local authority itself. When those changes have happened and the impact that can have on your staying close model. So I think it's really important, and I think it's been quite a tough lesson for some of the pilots, is getting that right and getting that understanding of what staying close is. And that's through having the right people on your operational boards, your holding strategy meetings. So there's a consistency, so that if a key player does leave, there's a clear understanding of across your staying close model of where that support is needed, whether that be, having your representation through your corporate parenting board, or, so when somebody, I know that both Julia and Sandra have been through that with their governance. Sandra probably more recently, in the sense of, a DCS having different focus, different ideas, different understanding of what, whether staying close is relevant to that local authority. But, and that's been a really tricky thing to work through. So, really think about where your governance is, who you need to have that across local authority, that approach. So as I said, if somebody moves, if there's one of those key players goes, it doesn't kind of crumble with that key player. So yeah.
Yeah, the emphasis has been very much on a strong partnership with housing, with health, with the leaving care teams. It's very much a partnership approach. So we've had some clarification questions. We've had some questions on the model. We've flagged that we've got another webinar on the 19th of May, and we would be interested to know what would be useful. We're thinking about some of the people you've heard from this afternoon doing a more formal presentation on the learning. Just to say that in the information gone out, there is an overview of each of the projects in the handbook that sets out the staying close framework and model. And what you will have also seen, I hope, demonstrated this afternoon, is that this group work as a team. There is a community of practice, an honest sharing of what works, what hasn't worked. It hasn't all worked. We'll share a bit more of that on the 19th of May. Coaching has been a privilege and a pleasure in seeing how the projects, it has been a roller coaster. It has been through the pandemic, but there's continued innovation, as you've heard this afternoon, that will provide firm foundations to support new providers and help the existing providers continue to thrive. So I'm going to hand over to Katie for a final comment, and then David to close our discussion this afternoon. Katie, any final thoughts?
Thank you. Yes, you've hit on one last final point that I think has been really, which has made staying close so successful, and that's kind of that real community of practice, of support that the pilot groups and the project leads that have been involved have really brought to the table. We've pulled together, Francis, Mutual Ventures, that and DFE, we've pulled together some really good workshops, learning events, which we want to continue. We want to continue that support. We don't want a new provider to feel like they're on their own, that they don't have somewhere to come and ask these questions. So, you know, nothing's a silly question. We've got the Staying Close mailbox open, fire away. You know, this is your opportunity to ask those cheeky questions. You might not get an answer all the time, but you may as well ask. And you know, it's been such a successful model because of that support, because of that open environment. And I hope I'm not the only one feeling it. I hope that the project leads have felt that, and the coaches over the time as well. And if we can continue to have that in place, you know, I'm really excited about the next 3 years and what we can achieve moving forward. So thank you.
Thanks, Katie, and thanks everyone for dropping in today. I know it's short notice, but hopefully you've found that helpful. Thank you to our speakers for sparing their time, and for Katie for dropping in on her holiday for this session. Appreciate that. And many thanks for your insights this afternoon. Do look out for our session, as Francis says, on the 19th of May, which will share learning in a more structured way from the pilots. And I understand that there won't be central funding for support for those receiving funding to set up their Staying Close projects in the way that the pilots have benefited from it. So it will be important to factor that into your bids if it's of interest to you. If you'd like to explore that in more detail, please contact either myself or Francis directly. But enjoy the rest of your day. Thanks for dropping in. Take care. Bye-bye now.